again, and welcome back to Breakpoint Safety Talks. If you don't already know, my name is Rachel Dreyer. On this episode, we will be discussing the different types of heat-related illnesses. Let's start off with understanding what are heat-related illnesses. Heat illness means a serious medical condition resulting from the body's inability to cope with a particular heat load. People suffer from heat illness when their bodies are not able to get rid of excess heat and properly cool. The body loses its heat balance because it cannot shed heat at a fast enough rate. When the body starts to overheat, the blood vessels get bigger and the heart beats faster and harder. More blood flows to the outer layers of the skin from the internal core so that the heat can be released into the cooler outside environment. If this process does not cool the body fast enough, the brain triggers sweating to cool the body. As dehydration gets worse, the body can no longer keep its temperature within the normal range. Sweating stops and severe heat illness occurs. In heat stroke, the person's body temperature rises rapidly, damaging the brain, muscles, and vital organs, sometimes causing death. Now that we understand what is considered a heat illness, let's go into depth about the different types of heat illnesses and the signs and symptoms of those heat illnesses. Heat rash. Heat rash is a skin irritation caused by excessive sweating during hot, humid weather. Symptoms of heat rash include red clusters of pimples or small blisters. These usually appear on the neck, upper chest, groin, under the breast, and in elbow creases. Heat cramps. Heat cramps usually affect workers who sweat a lot during strenuous activity. This sweating depletes the body's salt and moisture levels. Low salt levels in muscles can cause painful cramps. Heat cramps may also be a symptom of heat exhaustion. Symptoms of heat cramps include painful cramps, especially in the legs, flushed, moist skin. Heat syncope. Heat syncope is a fainting episode or dizziness that usually occurs when standing for too long or suddenly standing up after sitting or lying down. Factors that may contribute to heat syncope include dehydration and lack of acclimatization. Symptoms of heat syncope include fainting, usually in short durations, dizziness, lightheadedness from standing too long or suddenly rising from a sitting or laying down position. Rhabdomyolysis. Rhabdomyolysis, also known as rhabdo, is a medical condition associated with heat stress and prolonged physical exertion. Rhabdo causes the rapid breakdown, rupture, and death of the muscle. When the muscle tissue dies, electrolytes and large proteins are released into the bloodstream. This can cause irregular heart rhythms, seizures, and damage to the kidneys. Symptoms of rhabdo include muscle cramps and pain, abnormally dark urine, tea or cola colored, weakness, and exercise intolerance. Heat exhaustion. Heat exhaustion occurs in conditions of extreme heat and excessive sweating without adequate fluid and salt replacement. Remember, heat exhaustion starts when only 3% of the body's water is lost. Heat exhaustion happens when the body can't cool itself correctly. If left untreated, it can progress to heat stroke. Symptoms of heat exhaustion include muscle cramps, pale moist skin, fever over 100.4 degrees Fahrenheit, nausea, vomiting, diarrhea, headache, severe fatigue, weakness, anxiety, fainting, and decreased urine output. Heat stroke. Heat stroke is the most serious heat-related illness. It occurs when the body can no longer control its temperature. The body's temperature rises rapidly, the sweating mechanisms fail, and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. Heat stroke can cause permanent disability or death if the person does not receive emergency treatment. Symptoms of heat stroke include warm, dry skin, high fever, often over 104 degrees Fahrenheit, rapid heart rate, loss of appetite, nausea, vomiting, headache, fatigue, confusion, agitation, being lethargic, and seizures, coma, and death is very possible if treatment is delayed. To gain a better understanding of the proper steps that employees and employers should take when providing first aid to someone experiencing heat-related illnesses, make sure to watch our Safety Talk episode on emergency response to heat-related illnesses. Thank you so much for watching this episode of Breck Point Safety Talks. Always remember to follow proper procedures to keep you and everyone around you safe. Until next time, stay safe out there.